and welcome to Deuk Spine Institute live spine surgery stream, December 11, 2025. Our patient travels here from Kuwait. If you look at the x-ray, you can see that he is a victim of what is plaguing our industry and medicine today: greed, corruption. He has 4 fusions in his neck. Each one of those is a cage. Each one has screws that are screwed into the spine. Each one is a fusion. He has 4 discs that are fused, and look at the curvature that they fused him in. His spine is twisted off to the left. Sorry, is that the left or the right? Let's see, shot. Twisted off to the right. The poor man, his spine alignment is altered forever. Now, show us above the fusion. And go to the left. Look at the arthritis that's developed right there. Stop. Go up. Up. Stop there. You see that black line? Follow it out to the left. That is a huge bone spur. That's where his pain's coming from. He has bad arthritis at 2-3, 3-4, and below his fusion at 7-1. So I'm going to go in and treat the facet joints above and below his fusion. He has basically adjacent segment disease because he had a fusion. This is every patient with fusion gets these problems. And he's traveled here to Florida because he trusts Deuk Spine Institute to do what's right for him. All right, now I've got to talk to my team for a moment. All of this is prepped very well. Yes, sir. All right, and then we're going to do the DPR here, and then Patel will come and do the DPR for the occipital nerve. All right, go ahead and inject and incision. Oh, he's a little light. We're going to give him just a minute, to get a little sleepier. All right. Put the Raytech there. Leave it there. Shot. Luis here. Num. Right where my tip is. Right there. And now, yeah, he's still reacting just to the injection. Here, Luis. Here. Shot. Hold on. Shot. Right there. And one more. Shot. Everything is okay, sir. Hold on. Shot. Right there. Okay. Yeah, he's responding. He's not happy with the fact we're injecting with a 22 gauge needle. So let's get him asleep here. While we're getting our patient sleepier, Henry, show the audience the 30 different things that cause neck pain. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-C3. Next is C3-C4, C4-C5, C5-C6, C6-C7, and C7-T1. The most common disc to be injured and cause neck pain is C5-C6, followed by C6-C7, followed by C4-C5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-C6, C6-C7, and C4-C5. C7-T1 is another common facet joint to be injured. These joints, after injury, to the capsule will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back, Sean. Our patient is undergoing the Deuk plasma rhizotomy, and I'm getting down to his spine right now at left side C2-3. That's where my target is, C2-3 left, Sean. That's perfect. Just need to be a little bit more lateral. Now he had four discs fused in his neck. I think C3-4, 4-5, 5-6, 6-7. Shot, you can see it where they put all that hardware. Okay? Just so you know, completely unnecessary. However, he did not know about Deuk Spine Institute until recently. And had he known, he would never have had that procedure done. I would never recommend that procedure to be done. It is the worst procedure possible. I understand. Shot? Yeah. Is he okay for you? He's fine. He's just very deep. And I'm trying to get down there to affect the change that needs to be affected. I'm not able to get all the way down. Hold on. Shot? No. I'm not surprised. No, come on. Pressure. The problem is I'm getting caught here, Luis. I need a blade. For cervicals especially, it's important that we get all of these off. They just get caught up on the fascia. Yeah, just keep that blood pressure down. Yeah, well, we just haven't really been able to do what we need to do. To be able to get down to the facet, I need to get past the fascia. And the fascia is a very strong barrier. Come on, Jordan. And there we go, finally. Sean? Any questions? Did you run the video?
Yes, we did.
On how facet joints cause pain?
Oh, no, we have not. Not for that one.
There we go. Finally there. All right, got it. Shot. That's one down. That's good. So I've just completed the left side treatment with Deuk plasma rhizotomy. We still have to do his occipital nerve. We're just going to put a little pressure. I'm going to put some medicine. Hold on, I can't see. If you have questions, happy to answer them for you guys. He has a very muscular neck. I can tell you that. I'm amazed at how deep and muscular it is. I want to get the eye band out of there. Just enough. Henry, any questions? That's enough. That's enough. That's enough. Let me see.
At this
the hole
moment,
you
no
made.
current questions.
Where's the hole? All right, stop. Let me have a scissor. I don't want to drag an unsterile area here. Okay? It's supposed to be a small hole. That's all. Wipe. You definitely clean the hair well? Yes, sir. Damn it. All right, knife. Shot. Shot. Where are you going? Yeah, where is Patel? And did he answer? And what did he say when he answered? Oh, so he's still in clinic. This poor man's neck is so twisted from all the surgery. You guys see all those cages and screws?
Yes, we do.
I mean, none of that helped him, by the way. I need the fluoro to be lined up better, Jordan. I'm having a hard time seeing his facets. I think I see them, but his bone is a bit osteopenic. That's better. Yeah, that's better. Yeah, look how hard it is to see his bones, folks. That's because he has osteopenia, thin bone. And why does he have thin bone? Well, he's been inactive. Why is he inactive? Because he's been in pain. So pain needs to be treated before it causes other tissues in your body to atrophy. Okay? Your body tissues will atrophy. They will just completely shrivel up and become weak when you don't use them. There's an old saying, if you don't use it, you lose it. And that's what we got going on here. All right, that's one side down. We're going to move to the other side now. We use a nice medicine called Exparel, which is great for muscular pain. Perfect. And this is a muscularly painful surgery. Shot. Shot. Yeah. He has a lot of muscles in the back of his neck, and muscles have blood vessels. They bleed. They bleed a lot, actually. Shot. All right, perfect. We're heading to the spine. Shot. I diagnosed him with facet joint pain on a Zoom call. He was in Kuwait with his family. I was in Florida with my family at my house where I do my telemeds. And in that 10-minute call, I was able to figure out where his pain is coming from. He had cervical facet pain above his fusion, below his fusion. He had occipital neuralgia on both sides. So, Sean, I think I'm a little lateral there. We recommended the treatment, and here he is. He came here for the treatment. He's already had his lower back treated. His lower back pain is gone. He's very happy with those results. Now we're just trying to get rid of his neck pain. Shot? All right. 3 out of 4. One more to go, and then we're going to be doing his occipital nerve Deuk plasma rhizotomy for occipital neuralgia. Go ahead if you can find it. Try not to disrupt. Now who's going to get, when is he coming to get these out? Tomorrow?
Yes, sir. Yes.
Looks good?
Maybe one more.
All right, we put staples in. We're going to get them out the next day. Is Patel here? Dr. Patel, welcome. Shot? Are you going to need to reposition him for the occipital nerve? You think you can do it from here? We have the master of destroying occipital nerves here right now, Dr. Bharat Patel, the man himself. You see that fusion he's had? 4 discs fused. Someone went to town on this poor man. I just saw dollar signs and just filled him full of metal. No, it was done in, I believe, in Kuwait. And he's just sick and tired of the doctors in Kuwait telling him, oh yeah, you just need another treatment. You need another treatment. Let's try another treatment. And none of it works. So he got on the internet and he found Deuk Spine. And he said, I'm going to go to Deuk Spine Institute. Because Dr. Deuk Majin, Dr. Patel, they know what the heck they're doing. At least Dr. Deuk Majin does. Just kidding. All right, folks, I've enjoyed being with you. And Henry, if you want, you can keep the camera rolling and get Dr. Patel's treatment. But I feel like we got the facets good, all the way down to T1.
Copy that.
Shot? Yeah. Bharat, he's all yours. Make him happy. All right, folks. Any questions for Dr. Deuk Majin?
At this moment, no current questions.
In that case, I'm gonna hand the scalpel over to Dr. Patel. Let him treat the occipital nerves. For those of you who don't know what occipital neuralgia is, it's pain that shoots from the base of your skull up above your ear. Thank you, everybody. And it causes these horrible pains from compression of the C2 nerve root, which is all sensory. There is no C1 nerve root, but there is a C2, and it becomes the greater occipital nerve or occipital nerve and wraps up around the back of your scalp. Any questions?
At this moment, no current questions.
What the heck?
Did you get a chance to try the cherry ones?
I did. I love it. Thanks. Any questions about occipital nerve rhizotomy?
At this moment, no current questions.
All right. Thank you, Dr. Patel, Dr. Berndez. Thanks, everybody. Dr. Patel, I got the op note. I'll take care of it. At least Luis will. Thank you, Luis. Thank you. Cheers. Our other patients are already gone. The last guy is feeling great, no back pain. We only have this gentleman to go home. Thanks for joining us. We'll see you all next week.